Hi, welcome to our presentation. We are presenting on systems of belonging, healthcare organizations and teams during the COVID-19 pandemic. I'm Sally.
I'm Zach.
Deanna.
Alyssa.
I'm Rachel.
I'm Shadi.
I'm Lauren.
And I'm Paisley.
Okay, so what is radical belonging? It's the acknowledgement, understanding, and acceptance that all persons are individuals with their own unique experiences that add to society's collective perspective. In other words, I don't like you in spite of our differences, I like you because of our differences. Radical belonging, it provides a way for differences to be celebrated because it is understood that within those differences lie experience and not knowledge that we are otherwise ignorant to individually.
So what does this have to do with healthcare? So healthcare teams consist of a diverse group of individuals with different areas of expertise and abilities that could contribute to a patient's care. This could include dietitians, interpreters, nurses, nursing assistants, PTOT, pharmacists, physicians, social work, and technicians. And these individuals can be represented in this case presentation. For example, Kadra is a family medicine physician who has a team consisting of RNs, nursing assistants, unit clerks, and social workers, and environmental services. Some of these individuals are represented in the case as well, such as Sarah as an RN, Jesse as a nursing assistant, Jonas as environmental services, and Andrea as the unit clerk. Each individual has a different demographic background, has different life experiences, and unique approaches to patient care.
So now that we know a little bit about what radical belonging is, as well as who makes up the healthcare team, it's a little important to kind of talk about the intermingling of the two. So as we kind of learned in the article that was provided to us toward radical belonging, envisioning anti-racist learning communities, we can see that belonging positively impacts motivation, participation, achievement, self-efficacy, and mental health. And in addition to that, the positive effects are increased in students of color as compared to those of their white counterparts. Kind of transitioning the educational belonging into healthcare, it's noted that with lack of belongingness, healthcare workers note decreased morale, and it's also more difficult to keep and retain healthcare workers in those positions as they don't like their job and don't want to stay. These feelings of unbelongingness are associated with depression, emotional exhaustion, and depersonalization, which all around can lead to worse patient outcomes and errors that are either self-reported or documented by other professionals.
So now I'm briefly going to talk about some of the impacts of the COVID-19 pandemic, especially as they relate to marginalized populations and healthcare providers in different fields. So COVID has obviously impacted just about all of us, but it's impacted us differently, and it's impacted some people more than others. Marginalized communities have suffered an inequitable amount. So for instance, the mortality rate of COVID among Black individuals who happen to be more likely to work in frontline jobs has been substantially higher than that of white individuals. Black children have been much more likely to lose a parent or grandparent to COVID, and the effects of the pandemic for them are going to be felt for generations because of this. Latinos have also suffered an outsized amount of cases and deaths relative to their makeup of the population. And this is another group that's more likely to work in frontline jobs that haven't been able to stay home and work from home throughout the pandemic. There was a massive increase in hate crimes against Asian Americans that was fueled by misinformation about the pandemic. And then 95% of COVID deaths occurred in adults over 50, with the elderly being another marginalized group. So LGBTQ status also correlated with adverse outcomes during the pandemic, such as pandemic-related job loss or adverse mental health events. And we know that it's been found that socioeconomic factors like household income and size or population density are a mediating factor for why some of these disparities exist. And then we know that those marginalized communities are often already struggling with an unfair uphill battle when it comes to these factors. And so the bottom line is that when we make our proposals for how to deal with the effects that COVID has had on workplace belonging and well-being, they should be made in a way in which to specifically impact those people who have been greatest affected by the pandemic. So what effects has COVID had on healthcare providers? So we've seen in the case outline that was given to us that healthcare workers are currently leaving the field at a very high rate. And this runs opposite to an even greater need for more healthcare professionals at this time. Workers are dealing with increased amounts of stress that's brought on by long hours, compassion fatigue, and a changing workplace amidst the effects of the pandemic. So given the info from the previous slides, healthcare workers from marginalized communities then are at even greater risk of suffering negative effects due to the pandemic. So taking a look at some of the individual cases that were given to us. So first, we've got a family medicine physician who's dealing with trauma from the effects of the pandemic, as well as the effects of low staffing in her practice. We've got a nurse who's struggling with increased stresses at home that are compounded by the fact that her work is understaffed and she's underpaid. We have a nursing home aide whose work during the pandemic is unappreciated by her supervisor. She deals with the added stress of insensitive remarks that are made to her from coworkers and patients, and she feels underpaid as well. There's the environmental services worker who's been on the front lines at the hospital since the beginning of the pandemic, and they feel underpaid and unappreciated. And then we have the administrative representative who's feeling burnt out, exhausted due to the increased burden of COVID-related problems at her hospital. And so the common themes that we see in these cases is that employees feel overworked, understaffed, underpaid, and underappreciated. And our proposals aim to address these concerns in an equitable fashion.
So in terms of the organizational, team, and individual considerations related to radical belonging and well-being, we have a few proposals. So for organizational considerations themselves, we want to be able to make clear-cut roles for the employees in order for them to know what's expected of them, what they need to accomplish, while also keeping them safe and in a place that's secure. So we would want to be able to learn from criticism, to give credit where credit needs to be given, view employees as individuals and not as people that are basically workhorses. In order to do this, we need to establish values and goals for the company and how that relates to individual purpose, and to design benefit plans so that our employees are full of benefits and feel welcomed and happy at work, so they're not overworked.
Along with considering the organization, we also have to consider our healthcare team. There was a study done in April of 2022 that interviewed inpatient and outpatient health care employee team members, specifically about belonging and feelings of not belonging. So what they found was that well, first off, they interviewed RNs, environmental services workers, nurse practitioners, physicians, technicians, and a few other healthcare team members. And what they found was those who are working in outpatient settings, they said, this is what makes me feel like I belong. If there's better scheduling, when there's team cooperation and mutual respect, when there's transparent communication, when people are being supportive, when you're being able to seek input from other staff members, and also advocating for the inclusion of everyone. The healthcare team members that worked in inpatient settings believe that mutual respect, opportunities to give feedback, acknowledging new and active learners, being able to attend and go to social events outside of work, being able to collaborate and communicate between team members were all part of what would made them feel like they could belong. So I think what's important to note here is that communication and cooperation between healthcare team members is key to incorporate and to bring about radical belonging.
So as we trickle down through organizational, team, and now individual considerations, we have to remember that the staff that we're talking about, they have lives and personalities and, troubles and issues outside of work. So we want to provide these individuals with growth and support. We need mental health support, surveys to see how they're doing, how they like the improvements we're making, any job advancements, check-ins to make sure that they're doing well outside of work. We want to offer opportunities for people in various professions to join the decision-making process. So as we implement different plans and different proposals, we want their input as well. So that includes suggestion boxes and meetings to communicate those